Okay, welcome everybody. It's lovely to be here today talking to you about group consultations, and it's really exciting because I just came in just at the end of the morning and you were telling us, you know, what's the unique contribution of practice nurses and also what support do we need to move forwards and make a difference. And I think that after my presentation, I really hope that what you're left with, and particularly when you hear Linda's story, is that group consultations actually could be a really, really simple way in which you could lead change and benefit massively yourself and your patients. I know that there are practices already in this STP who are running group consultations. Is there anyone in the room who's actually been running group consultations in their practice? Fantastic. Yeah, I recognise that lady there. So this is, you know, this is really real, and it's a real way in which you can make a huge difference. And by the way, it not only restores joy, but it gives us back a bit of fun. Who would like a bit more fun? Who would like a bit less repetition? Who would like a bit more time with patients to get to know them as people and to talk about what matters to them? And who'd like to maybe work with people rather than being stuck in your room all morning on your own? Welcome to the world of group consultations. So in the next sort of 25 minutes or so, we're going to have understood the policy context. So just signposting for you some of the reasons why we're talking about group consultations. We're going to talk about how group consultations work and how they flow. I was going to show you a video on that, but I've got to cut down the presentation a little bit. So what we'll do is make sure that you've got a link to that so you can go and watch it after today. We're also going to talk about the impact on patients, and we are going to listen to patients talking about their experience. When you listen to that, what I want you to remember is that they're talking about a QOF review. Okay, just plant that seed in your mind. We're also going to talk about the impact on clinician experience, specifically general practice nurses, and then Linda's going to share her experience of consulting with groups in Tower Hamlets. And then we'll have a little think about how group consultations can actually help us. And anyone who's interested in being, you know, taking forward a discussion with their PCN about group consultations, this is something that nurses can really lead on. Come and see me and I will help you to secure funding to take this forward in your practice. So the policy context. While group consultations is mentioned as part of one of the GP forward views, that was based on some work we did in Slough. So I know many of you operate in places where there's lots of different diverse people. In Slough they speak 137 languages. So Slough is not that different to a lot of the places where you work. I'm working with Karen Story linked to the General Practice Nurse 10-point plan, because not only is group consultations an amazing way of improving outcomes for patients, it's also a really powerful workforce development tool. So 6 out of the 10 points in the GPN 10-point plan, group consultations achieve them. A really important one for those of you in the room who are HCAs is that HCAs often act as the facilitator within group consultations, and that is a fantastic opportunity to build skills, listen to a clinician talking with patients about conditions like diabetes, etc., and that really builds confidence and the skills within the people who work alongside you. And then we come on to primary care networks. Well, some of you will know that primary care networks have to deliver 7 national service specifications next year, which includes things like a cardiovascular disease service specification, which is basically a little bit like pre-diabetes, but there's going to be masses more patients that you need to do reviews on. So why not do them as group consultations from the start? Because actually it's going to save a lot of time, avoid a lot of repetition, and you'll probably get better outcomes. And then we've got the additional roles that you heard about this morning. And, you know, not surprisingly, there is quite a lot of kind of skepticism shall we say, about the new roles and how they fit in, and why we're perhaps not investing in skilling other people up within the primary care team. And one of the things that group consultations can really do is to help to break down those barriers and to help you to work with, say, a clinical pharmacist and learn about what they tell patients about medication, and they can learn from you how you support patients to manage their chronic conditions. So there's lots of good reasons why we would want to do this. I also want to just say something quickly about leadership and general practice nursing, because these are the 6 things within the general practice nurse 10-point plan that group consultations support. And, in my experience so far, working with group consultations over the last 4 or 5 years, even if GPs start off as the people who use group consultations to begin with, very quickly it becomes nurses' domain. This is your work, and you can do it in a much better way that has a better impact for you and for your patients. So how do group consultations flow? These are group consultations happening in primary care. So if you're a small practice, you can do it in your reception waiting area if you need to. If you've got a room in the practice, you can use that. It looks quite chaotic. There is a process behind it. There is a flow to it, which we teach you when we do our practice development days. And the beauty of it is that you get patients get the opportunity to be advised and supported by other people with the same condition, and you do all your clinical work that you need to do. Okay, we're not going to watch the video just because we haven't got enough time, but it's there, and you can, and I'm going to give you a link to a group consultations hub that you can go and watch loads of videos and things on. So there are 3 roles: clinician, that's the person who's consulting with the patients; the facilitator, who supports that person, holds the space, makes sure that you stick to time, make sure that everybody gets their say, is there to back up the clinician and help manage the group dynamics if anything unexpected happens. And then, of course, you need your admin team behind you. From simple things like making sure that everybody gets told to arrive at the same time, booking the space and making sure that everybody's results are all there so that they can be shared. So there's lots of benefits. This is one of the few innovations where there's actually already randomised controlled trials. What a randomised controlled trial means is that it's compared to usual care. So we've already compared in diabetes the impact on patients of a one-to-one appointment versus group care. And in 7 randomised controlled trials, HbA1c rose compared to usual care, and blood pressure and weight also, there were positive benefits as well. It also works really well for babies, group antenatal care, and there are trials going on of that around the country right now. And it also works very well for older people with multiple long-term conditions where there's reductions in their overall care costs. It's going to create time. It's going to have an impact on A&E use. The data suggests reduced bed days, hospital bed days, overall lower care costs, and reduced waiting times. What's the downside? You might be asking. So that's a little summary of the benefits for patients and for clinicians. And when you get the slides, you can have a look at that. It's like a Venn diagram. The ones in the middle are the ones that everybody benefits from. So what about the impact on practice nurses? Well, from what I've said already, you probably won't be surprised to find out that this is what people say. This is a comparison of group consultations versus one-to-one. So more people find it energising. They're not repeating themselves so much. It doesn't feel so much like a tick box. They have more time to explain because, surprise, surprise, lots of people ask the same questions, yeah? And they also have time to discuss what matters for patients. And this is how it impacts on the whole primary care team. So in some practices, truth be known, there's a little bit of a tribal thing that goes on. between the clinicians and the admin team. Does that ring any bells for anyone? So what group consultations does is it really breaks down that barrier, because you actually need the admin team to deliver care. Yeah, so it creates a whole host of really positive sense of all being in this together. And practice nurses say that it increases their feelings that they are actually leading change, learning from each other, they feel less rushed, they apply quality improvement principles, and they have more time to reflect and learn. However, there might be a little bit of a health warning. This is a quote from a practice nurse after her first few group consultations. So it does have quite a significant impact on how people feel about what they do and the role that they play in people's lives. It's kind of like, it feels a bit like the sort of thing you might say about being a parent as well. My son's just gone to university, and I'm really happy that he's gone. And on the other hand, I'm a little bit sad he doesn't need me so much anymore. So it's kind of the same thing, isn't it? But actually, when you see your patients transforming and taking control, and people that you've been telling have got diabetes for 10 years, suddenly starting to say, actually, there's a problem here, I need to do something, it's actually very, very affirming of the reason why you came into this work in the first place. So, patient experience, let's watch a video. Remember what I said, this is talking about a QOF review. So, really powerful, isn't it? And all we've done is change the way we consult. We're still doing our QOF review, still ticking all the boxes. The other thing that is different in this practice is that they've got over 1,000 diabetics in their practice population of 11,000 people in a very deprived borough in Croydon. And they used to spend 24 hours a week managing diabetes in specific diabetes clinics. Now they spend 6 hours a week. So they're seeing as many patients in a quarter of the time, and those patients, the indications are that their blood pressure and their weight and their HbA1c and blood pressure are all moving in the right direction, higher than they were before. So, less from me and more from Linda. So I'm going to hand over now.
So some of you have had an introduction to me already. I'm really grateful for Georgina to ask me to present with her, and I hope you find Georgina as inspiring as I did when I first came in contact with her. When it was our network leads that got us involved with Georgina and group consultations. I'm hugely grateful. So very briefly then, our practice in Tower Hamlets. So we've got 29,000 patients across 3 sites in Tower Hamlets. So we've got quite a high diabetic population. Nurses lead on diabetes care in general practice now. I mean, we do, and I'm assuming you all do. When I first started practice nursing, we were referring people to the hospital for diabetes. I'm sure some of you will remember that. We've now got group consultations at each of our 3 sites. Sue Ling here, sitting in the front, runs our group consultations at St Andrew's Health Centre. At Bromley Barbeau Centre, the health centre, we've got group consultations there as well. During our 10 years of networks in Tower Hamlets, we have already systemised diabetes care. So we run along the lines of year of care. We have, general practice has organised care for diabetes in the way that we have patients have a 15-minute consultation with a healthcare assistant who does all their metrics and so on, and then a 30 to 45-minute care plan with the nurses. So as you can imagine, and with 6 monthly follow-ups or shorter intervals. So as you can imagine, for a population with a high prevalence of diabetes, that's quite a lot of appointments and nursing time. We did have groups that were precursors to group consultations, but they were an add-on to this. So we ran diabetes groups in our waiting room, and these were largely educational. They were co-produced with the patients. Patients could decide what they wanted to discuss. But no personal information came out in there. I was really cautious before starting group consultations about disclosing any personal information between patients. But what you will have seen in the video there was actually patients' results get written up on a board. Everybody can share results, and actually that has really motivated people to change. It's remarkable. People love seeing their results and comparing themselves to other people. And it's often a prompt for conversation amongst participants. So we've been running now for about 18 months. You can see their average group size 6, with the largest group has been 11. We have some rather elderly participants, which is great that they come. We hold weekly groups and alternate Bengali-speaking and English-speaking groups, and the Bengali-speaking groups are always with an advocate. As I said, they're co-produced. Patients decide what they want to talk about. Largely, it's about lifestyle. Through our year of care and systematic care for people with diabetes, we managed to control people's cholesterol and blood pressure. In fact, our Hamlets for many years was leading the country in their levels of control of blood pressure and cholesterol for people with type 2 diabetes. I can't say the same was true for people's HbA1c or their weight, but I think we're starting to make a difference on that. Inevitably, there's lots of questions between patients about each other. People are still setting themselves personalised and realistic goals in the groups, and developing their own personal strategies to support their changes. There's only really 2 or 3 people involved in this. So our trained care navigator is the person that does all the admin and facilitation. She calls patients, invites them into the group. She asks for their consent to share information. She prints out what we call a care plan, which is just a document with all of their last results and their most recent results, so they can compare last to their current status, and gives them an opportunity to write notes on throughout the consultation. We review the notes together before the session, and so if there are any changes that I think, or any things that I want checking with patients, she'll get the heads up on that and be able to go and speak with people about what's happening. So, for example, concordance is something that we often sort of highlight. So if somebody's clearly, their HbA1c is deteriorating, the question is, are they taking their meds? It's quite common to find that people aren't. So then she goes in and facilitates the group. We have a 1-minute feedback between us as I walk in, and then go and talk with people about the goals that they've set with her, what they've been discussing in the group, and any issues or concerns that individuals have. What is really, really interesting is what comes out of these groups. People raise concern about loneliness, bereavement, mental health issues, unstable or random issues about their home life, lack of control. We have several people whose shopping and cooking is done on their behalf. They don't feel that they've got any control over what their food intake might be, and often a lack of agency until they come in. For complex cases, we have a multidisciplinary meeting, so nurses and GPs meet every week to discuss complex cases. And so in many circumstances, we will have an answer before we go into group, or questions that we want to pose. This is Nassim, and I was very keen to make sure that you all knew who she was. She is one of our most fantastic colleagues who runs the group. She is so dynamic, and she really, really encourages people. She brings people along. Where other people have failed to engage people into conversation, she manages it. This is Nassim presenting a cheque to Crystal Oldman of the QNI when we had a fundraising thing. Not remotely connected to the group consultations, but you needed to know who Nassim is because she's fantastic. The organisational outcomes for this are joy. This is me jumping for joy. I don't usually look like that, but there's me with a big smiley face. 90 minutes of nurse time. Georgina said it before, but actually in my practice, we save 90 minutes of nurse time a week because I'm not having to do one-to-one care plans with people sitting behind closed doors. And I'm redeploying that. I'm doing phone consultations. We're going to be starting doing video consultations. It gives me an opportunity to be on call to whomever needs me. So that's really released me to do a lot of other things, and it just feels brilliant. And it's been a really good development opportunity for Nassim, who's our care navigator. In our other practices, healthcare assistants are taking up the role of facilitator of the groups. But actually, we would have lost this individual. She was about to go elsewhere, and we created a role for her, not just around group consultations, but about peer support, about community engagement and development. And so, you know, this is a great opportunity for other people in your practices to develop their skills in dealing with people. The clinical outcomes are, you know, amongst a random sample of people that we've seen in groups, 67% of attendees have had a reduction in their HbA1c, and I can't say that I would have been able to give you those stats from my one-to-one care. Weight loss in 60% of attendees at 6 months. I'm hoping that's going to be an ongoing trend, but we'll just see. When I look, I put everybody's results on one spreadsheet, and when I look down at that, and I look at the BMIs down this one column, it just horrifies me, actually. So many people are overweight, and there's such a lot of work to do to try and encourage people to make their own decisions about what they want to do about their food intake and therefore their diabetes. There's further evaluation being done by some of our GP registrars on clinical outcomes. There's been an overwhelming positive response from patients from being in group. So from mingling with other people, being encouraged, getting friendly advice. The quote in the middle, you know, happy people help other people. That's true. If you're a bit miserable, it's quite hard to engage other people. You know, if you're not feeling happy yourself, it's really difficult to share positive things with other people. And a huge amount of understanding around their diabetes and managing it themselves. I think those are the key things. Interestingly, Georgina spoke about, you know, people with diabetes living with it for 10 years. And I have patients that I don't feel that I've had much impact on over 10 years, but when they come to group, it's quite different. I had one lady say to me the other day, we all knew it, Linda, you told us, we just didn't try, we didn't put it into action, and now, you know, she's in a group that's really making a difference to her. Some of the spin-offs, we've got weekly exercise classes, full of people who attended group consultations. In fact, the group is so full, we're going to have to hold another exercise class. There's people meeting new friends and rekindling old friendships, helping each other to class. One of my patients that I was speaking to the other day said, I'm going to bring Ivy to the group. I mean, she's 82 herself, but she was going to bring her friend who couldn't manage to get there by herself. So they were both in group the other day, and then making Christmas decorations together yesterday in another class at the practice. People taking the lead and showcasing their talents. It's really, really important that people feel some agency, and then they can share with others the joys of their life. And I had to put at the bottom, sharing traditional dance. So in one of our exercise classes, we have a lady who I've always thought was rather reserved. Well, but apparently not. When she gets in the exercise class, she just takes the outer clothing off and has been sharing traditional dances and teaching the rest of the group to to do some traditional dances, which I just thought was a lovely story. So I shall see this person in quite a different light when I next come in contact with her. Nassim's comments to me are always really, really valuable. So the top one, people feel that they're not judged and they open up. It just takes one person to open up and then they all do. And then she added, and the laughter, people do. They have a great time in group. Not always, I have to say that. Some groups are tough, and if for those other people that are doing groups, you know, occasionally it bombs. And it takes a lot of courage to actually try and retrieve it, but the vast majority are really, really positive. And then her comment at the bottom that I feel so passionate about the fact that people can change. If people leave smiling, having agreed to make a positive change, even a small one, it makes me so happy. So we have people whose personalised plan is to stop eating biscuits. Fine. We have others who tell us that they're going to, you know, start running every day for 20 minutes. That's brilliant. But actually, no one goal is better than somebody else's. It's what's important to the individual.
So I'm just going to finish off with a couple of slides which are mainly just about signposting you to some resources. So Linda and me, for today, we've written up a little case study of Linda's work. There's nothing more powerful than a case study to get your practice interested. So use this to talk to people back at the ranch about group consultations and maybe look at whether or not there might be some interest in it. On the back, there's also some information about the support that NHS England is offering to practice nurses specifically. So I'm looking for 3 practice nurses from this STP who have got experience of doing group consultations and would be interested in becoming an expert clinician mentor and being able to link in with other practice nurses in other parts of the country as well and start to champion this change. As I said, if anyone wants to take this as an idea to their PCN, there's actually loads of benefits for PCNs, so I will help you to talk to your PCN clinical director about it. And then finally, if you take a note of this, you can join NHS Futures, which is a website set up to support loads of different transformation pieces of work. So the GPN single point of access is on here as well. And then follow that link once you're on NHS Futures. It will take you to the group consultations website where there's masses and masses of resources that you can use to get you started. Thank you so much for giving us time today. I'm not sure that we've managed to stick to our 25 minutes, but hopefully it's given you a flavour of group consultations. I'll be around for a little bit if you want to catch up with me.
Okay, thank you.